Welcome to Study Nurse IQ. Today, we're diving deep into the fascinating world of blood types, a crucial topic for nursing students and healthcare professionals alike. Understanding blood types and compatibility is essential for providing safe patient care, especially when it comes to blood transfusions. By the end of this video, you'll be an expert on ABO blood groups and the Rh factor, and we'll test your knowledge with some NCLEX-style questions. Let's start with the basics. What exactly is blood? Blood is a specialized type of connective tissue that circulates throughout our body, carrying oxygen, nutrients, and other vital substances to our cells. It consists of four main components: red blood cells, erythrocytes, white blood cells, leukocytes, platelets, thrombocytes, and plasma. Red blood cells make up about 45% of our blood volume and are responsible for oxygen transport, while plasma, the liquid portion, makes up about 55%. Blood types are determined by the presence or absence of specific antigens on the surface of red blood cells. These antigens are proteins and carbohydrates that can trigger an immune response if incompatible blood is received during a transfusion. The ABO blood group system classifies blood into four main types: A, B, AB, and O, based on the presence of A and B antigens on red blood cells. Type A blood has only A antigens on red blood cells and naturally occurring anti-B antibodies in the plasma. Type B blood has B antigens on red blood cells and anti-A antibodies in the plasma. Type AB blood has both A and B antigens on red blood cells, but no naturally occurring antibodies in the plasma. Type O blood has neither A nor B antigens on red blood cells, but has both anti-A and anti-B antibodies in the plasma. Here's a helpful mnemonic for remembering antibodies. Your blood type antigens and antibodies are opposites. If you have type A blood, you have anti-B antibodies. If you have type B blood, you have anti-A antibodies. If you have type AB blood, you have no antibodies. And if you have type O blood, you have both anti-A and anti-B antibodies. The Rh factor adds another layer to blood typing. This is a separate antigen system from ABO, and it's either present, Rh positive, or absent, Rh negative, on red blood cells. When we say someone is A positive or O negative, we're referring to both their ABO type and their Rh status. Approximately 85% of the population is Rh positive, while 15% is Rh negative. Understanding blood type compatibility is crucial for safe transfusions. Type O negative blood is often called the universal donor because it can be given to patients of any blood type in an emergency. This is because O negative blood has no A or B antigens and no Rh factor to trigger an immune response in the recipient. Type AB positive individuals are known as universal recipients because they can receive blood from any type. Their plasma contains no antibodies that would attack incoming red blood cells. However, they can only donate to other AB patients, making their blood type relatively rare and specialized. When it comes to blood transfusions, the general rule is that you can receive blood from your own type or from types that don't have antigens your antibodies would attack. For example, a person with type A blood can receive blood from types A and O, but not from types B or AB, as their anti-B antibodies would cause a dangerous reaction. The Rh factor is particularly important in pregnancy. If an Rh negative mother carries an Rh positive fetus, her body might develop antibodies against the baby's blood. This typically isn't a problem during first pregnancies, but can cause complications in subsequent pregnancies if not properly managed with RhoGAM injections. For the NCLEX, remember that type O negative blood is used in emergency situations when the patient's blood type is unknown. This is because it's the safest option when there's no time for blood typing and cross-matching. However, due to its universal compatibility, O negative blood is often in short supply. Another high-yield NCLEX concept is the recognition of transfusion reactions. Signs include fever, chills, back pain, chest pain, and difficulty breathing. If these symptoms occur during a transfusion, the immediate action is to stop the transfusion and maintain IV access with normal saline. When memorizing blood type compatibility, think of it as a one-way street. O can give to all types, but can only receive O. AB can receive from all types, but can only give to AB. A can give to A and AB, and can receive from A and O. B can give to B and AB, and can receive from B and O. Let's talk about blood type frequencies in the population. Type O is the most common, followed by type A, then type B, and finally type AB being the rarest. This distribution varies among different ethnic groups and geographical regions, which can affect blood bank inventory management. Blood donation criteria extend beyond just blood type compatibility. Donors must meet specific health requirements, age restrictions, and waiting periods between donations. For whole blood donations, individuals typically must wait 56 days between donations to allow their bodies to replenish red blood cells. The process of blood typing involves mixing a patient's blood with known antibodies and observing for agglutination, clumping. This is called forward typing. Reverse typing is also performed by mixing the patient's plasma with known red blood cells to confirm the results. Both tests must match for accurate blood typing. Cross-matching is an additional safety step performed before transfusions. It involves mixing a small sample of donor blood with the recipient's blood to ensure compatibility. This test can detect antibodies that might not be apparent in routine blood typing and helps prevent transfusion reactions. Modern blood banking practices include extensive testing of donated blood for infectious diseases, careful labeling, and strict storage requirements. Blood products have different shelf lives. Red blood cells can be stored for up to 42 days, platelets for only 5 days, and plasma can be frozen for up to 1 year. Remember these key points. Blood types are determined by antigens on red blood cells and antibodies in plasma. The Rh factor adds another layer of compatibility consideration, and understanding who can donate to whom is crucial for safe transfusions. Always verify blood products thoroughly before administration, and monitor patients closely for any signs of transfusion reactions. Now, let's test your knowledge with some NCLEX-style questions. Question 1. A nurse is preparing to administer a blood transfusion to a client with type A negative blood. The nurse should anticipate that the client can safely receive which of the following blood types? AA positive and O positive, BA negative and O negative, CA positive and AB negative, DB negative and AB negative. Correct answer, B. A client with type A negative blood can receive blood from other A negative donors and O negative donors. The A blood type is compatible because it lacks the B antigen that would be attacked by the client's B antibodies. The O blood type is a universal donor and is compatible because it has no A or B antigens on its red blood cell surface. The negative Rh factor is crucial. Because the client is Rh negative, they can only receive blood that is also Rh negative to prevent an immune response. Question 2. A patient with type O positive blood is in need of a transfusion. Based on the principles of blood typing, which statement is most accurate regarding this patient's ability to donate and receive blood? A. The patient is a universal recipient because their blood contains both A and B antibodies. B. The patient can receive blood from A positive and B positive donors. C. The patient can donate to all positive blood types but can only receive from other O positive donors. D. The patient is a universal donor to all positive blood types and can receive blood from both O positive and O negative donors. Rationale. Correct answer, D. An individual with type O positive blood has no A or B antigens on the red blood cells, which allows them to safely donate to all other blood types that are Rh positive. They can receive blood from O positive and O negative donors because type O blood has no antigens to trigger a reaction from their A and B antibodies, and their positive Rh factor allows them to accept both positive and negative Rh factors. Question 3. The nurse is reviewing the laboratory results for a patient with type AB negative blood. The nurse understands that this patient's blood type has which of the following characteristics? A. No antigens on the red blood cell surface and both A and B antibodies in the plasma. B, A, and B antigens on the red blood cell surface and no antibodies in the plasma. C, B antigens on the red blood cell surface and A antibodies in the plasma. D, A antigens on the red blood cell surface and B antibodies in the plasma. Rationale. Correct answer, B. Individuals with type AB blood have both A and B antigens on the surface of their red blood cells. Since their body recognizes both A and B as self, their plasma contains no A or B antibodies. This unique characteristic makes them the universal recipient for the ABO blood group. Great job working through those questions. Let's quickly recap what we've learned today. Blood types are determined by antigens on red blood cells and antibodies in plasma. The ABO system, combined with Rh factor, creates 8 main blood types. Understanding compatibility is crucial for safe transfusions, with O negative being the universal donor and AB positive the universal recipient. Remember to always verify blood products and monitor for transfusion reactions. Thanks for watching Study Nurse IQ. Follow us on YouTube at Study Nurse IQ, Nursing Made Simple.